Zang, The Organ Systems of Traditional Chinese Medicine by Jeremy Ross. Chapter 4 Origins of Disease. The three basic components of disease are the body, the disease factors, and the pattern of disharmony. These three are so closely interwoven that they are really inseparable, but they can be arbitrarily represented. The disease factors are the originating or precipitating factors associated with the origin of the illness. The pattern of disharmony is the complex of internal pathological changes and external signs associated with this particular imbalance in the interaction between the body and the environment. The body is the foundation for the physical, emotional, mental, and spiritual life of the individual, and is based on an organizational framework of substances, Zheng, Zang, and tissues. Origins of disease. The Western and Chinese approaches to the origins of disease are very different. Harmony is the ultimate goal within Chinese mysticism, philosophy, culture, and medicine. Harmony within the individual, between the individual and the natural world, and between the individual and the society. Chinese thought sees the disease as disharmony, as a disharmonious pattern in the interaction between the body and the environment. Therefore, Chinese medicine aims at the accurate perception, classification, and treatment of patterns of disharmony in order to restore harmony to the individual. Western medicine tends to see disease in terms of biochemistry and bacteriology, not in terms of the harmony of the individual. It generally attempts to isolate a single cause from a linear chain of cause and effect, and to treat this single cause rather than treat the patient as a whole. In contrast to this reductive approach, TCM attempts to synthesize as complete a pattern as possible and does not strongly differentiate between cause and effect. Also, TCM does not think so much in terms of causes as in terms of disease factors that are associated with the origination or precipitation of disease. Again, it does not think in terms of a single factor, but in terms of a number of contributing factors. Especially, it views all the disease factors, all the internal pathological changes, and external signs of disharmony in the body itself as being integral parts of an overall pattern. The Western and Chinese approaches can be contrasted as follows. This account exaggerates the difference between Western and Chinese medicine. In some areas, the Western approach to disease is more sophisticated than is outlined above, and there are hints of causality in Chinese medicine. Disease factors. Disease factors are factors associated with the origin of disharmony in the body. TCM considers three main groups of disease factors, as shown in Table 4.1. The interrelationship between the individual and the environment may be arbitrarily divided into factors that are external, arising from the environment, internal, arising within the body, and miscellaneous, partaking of both body and environment. These three categories approximate to climate, emotions, and lifestyle. Table 4.1 Classification of disease factors. 1 is external disease factors, which is translated in Y in. Number 2, internal disease factors is translated to Nei in. Number 3, disease factors neither internal nor external or miscellaneous, which is translated to Bu Nei Y in. Table 4.2 List of main disease factors in TCM. Number 1, climate. It is 6 pernicious influences. or liu yin. Wind, cold, heat, damp, dryness, and summer heat. Number 2, emotions. 7 emotions, or qi qing. Joy, anger, pensiveness, sorrow, fear, fright, grief. Number 3, lifestyle, or miscellaneous. Bu, nei, y, in. Nutrition, occupation, overwork, exercise, relationships, sex, trauma, and parasites. External factors. TCM regards climate as the most important external source of potential disease factors. Climate is composed of 6 basic climatic phenomena or environmental factors: wind, cold, heat, damp, dryness, and summer heat. Fluctuation of the levels of these factors within moderate limits is a natural part of a healthy life. When these factors are in excess, they may become liu yin, variously translated as the 6 climatic aberrations, the 6 pernicious influences, the 6 excesses, the 6 external disease factors, and so on. In this book, they will be referred to mainly as external disease factors. An alternative Chinese term is liu xie. Xie may be translated as incorrect, improper, wayward, evil, or devilish. Hence, liu xie may be interpreted as the 6 evils or the 6 devils. In TCM, there is the important concept of xiu or impediment. As long as there is an adequate, unobstructed flow of qi and shui, there can be no illness in the body. Once there is an impediment to this flow, illness occurs. Generally, if the body is healthy and strong, yin and yang are in balance. Qi is sufficient, and the body is not affected by fluctuations in the climatic factors, unless these are both extreme and prolonged. If, however, there is internal disharmony, and the body, especially Wei Qi, is weakened, climatic factors may be able to invade the body and are then termed pernicious influences. A climatic factor only becomes a pernicious influence when it is involved in originating disharmony within the body. If the weakness of the body and Wei Qi is only mild, the struggle between pernicious influence and Wei Qi results in explosion of a pernicious influence and recovery of the patient. However, if the deficiency of Wei Qi is pronounced and the pernicious influence extreme, Wei Qi may fail to expel the pernicious influence, which may then go deeper into the body, so that the illness becomes more serious, recovery is delayed, and convalescence prolonged. In TCM, treatment aims at assisting the body to disperse and expel the external disease factors, in cases where these have invaded and lodged in the body. The term excess, with respect to a climatic factor, is relative. For example, one person may withstand extreme levels of heat, which in another person would precipitate illness, and yet the second person might withstand extreme levels of damp, which in the first person might originate disharmony. Also, the distinction between external disease factors and internal disease factors often becomes blurred. For example, wind, cold, heat, damp, and dryness may arise both externally as climatic factors or internally associated with internal disharmony. In diagnosis, it's most important to distinguish, for example, internal heat from external heat, since they represent different patterns of disharmony, requiring different treatment. Differentiation is made according to the signs of disharmony. For example, the external heat pattern may be associated with recent exposure to external heat, and with acute illness, the internal heat pattern may be associated with a more chronic illness and with signs of long-term disharmony of one or more Zang fu. Furthermore, one liu xie may transform into another. For example, once it has invaded the body, external wind cold may transform into heat. Internal damp may give rise to internal damp heat, or to internal fire, and both external and internal cold and damp may give rise to stagnation and phlegm, the two secondary disease factors mentioned on page 44 and discussed in detail in later chapters. Wind. Wind, the climatic factor, is a normal part of the natural environment. When the body is weak, if wind, the climatic factor, is in relative excess, it may enter and injure the body, and is then termed wind, the pernicious influence. Wind may also be considered as any sudden change of the climate, and is often closely associated with other factors such as cold, heat, damp, and dryness, potentiating their effects and enabling them to invade the body more easily. TCM recognizes such combination of disease factors as wind cold, wind heat, wind damp, wind dryness, and wind phlegm. As wind in nature moves the leaves and branches of the tree, so wind in the body may affect the body parts and functions. Wind is characterized by constant movement, and the effect of pathogenic wind in the body include abnormal movement or rigidity of head, limbs or trunk, such as numbness, spasms, tremors, and convulsions. Since wind is light and young, it tends to affect the top of the body, especially the head, neck, and face, and to affect the outermost parts of the body, especially the skin and muscles. In five-phase theory, wind is associated with spring, but the phenomena of external wind and internal wind are not limited to this season. Sudden changes of the weather, or winds as such, may occur at any time of the year. Spring and autumn are especially changeable, but there are often sudden warm spells in winter and sudden cold spells in summer. External wind. The body may be invaded by external wind following a sudden change in climate, by exposure to wind, especially after perspiring, or by sitting or sleeping in a drought. The signs of invasion by external wind are often of sudden onset, with fever, sweating, aversion to wind, headache, nasal obstruction, sore or itchy throat, superficial pulse, and tongue with thin coat. This roughly corresponds to the early stages of infections or contagious diseases in Western medicine, such as the common cold and influenza. Table 4.3 Signs and pathology of external wind. Signs of fear of wind, which pathology is failure of Wei Qi to warm skin and muscles. Signs of fever, which pathology is struggle between Wei Qi and pathological wind. Signs of perspiration, which pathology is weakness of Wei Qi allows opening of the pores. Signs of nasal congestion, itchy throat, and headache. Those pathologies are wind tends to invade Fei, which governs the nose and throat. Signs of headache. The pathology is wind invasion of Jingluo of the head, especially Taiyang, disturbs the circulation of qi. The signs of superficial pulse, which pathology is effects of wind invasion, are mainly at the surface of the body. External wind tends to affect the uppermost and outermost parts of the body. Since Fei is considered to be the yin organ system in most direct contact with the external environment. It is a Zang, most commonly invaded by wind, especially by wind cold and wind heat, which may transform into one another. Internal wind. Both internal and external wind are light and yang, and tend to affect the upper part of the body, especially the head, neck, and face. However, they have different origins and different signs, and do not generally give rise to each other. Where external wind results from the exposure of a weakened body to sudden droughts or changes in climate, internal wind arises from a variety of different causes, including deficient Xue, high fevers, and hyperactive Gangyang. Internal wind is discussed in Chapter 9. Just as Zang, most associated with internal wind is Fei, internal wind is closely associated with disharmony of Gan. Internal wind represents sudden irregular movement, the opposite of the smooth, even flow of qi promoted by Gan. These rapid gusts of upward movement disturb the movement of qi and xue in the Jingwo, and may be accompanied by tics, tremors, spasms, convulsions, dizziness, or loss of consciousness. External wind is associated with the early stage of infectious diseases, whereas internal wind may be associated with such disorders as high fevers, facial tremors, and cerebrovascular accidents and their sequelae. Both external wind and some forms of internal wind may be accompanied by fever, but at the opposite extremes of the scale. External wind may be associated with relatively mild fever at superficial depth in the body, corresponding to the Tai-Yang stage of cold diseases. In contrast, internal wind of the type associated with utmost heat may relate to the deepest, most serious stage of fever, the Yin stage of the warm disease classification. Relationships to other factors. External wind may potentiate the effect of cold in the body, and the two factors may be very closely related. However, the signs associated with the wind may be differentiated from those associated with cold. Table 4.15. Comparison of the signs of external wind and external cold. Common signs. Fear of wind and cold. If happens by external wind, if aversion to wind. If fear of wind and cold happened by external cold, the patient aversion to cold. Common signs of fever. If fever happens by external wind, it has perspiration. If fever happens by external cold, patient has no perspiration. Common signs of headache. If it happens by external wind, patient has no shortness of breath. If headache happens by external cold, patient has shortness of breath. Common signs of superficial pulse. If it happens by external wind, the patient's pulse not tight. The superficial pulse happens by external cold. The patient's pulse is tight. Similarly, the signs of external wind cold can be differentiated from the signs of external wind heat. Table 4.6. Comparison of the signs of wind cold and wind heat. Common signs of fever and chills. If it happens by wind cold, patient has more chills than fever. If fever and chills happens by wind heat, the patient has more fever than chills. Common signs of perspiration. If it happens by wind cold, people has less perspiration. If perspiration happens by wind heat, patient has more perspiration. Common signs of a superficial pulse. It happens by wind cold. It has tighter superficial pulse. If superficial pulse happen by wind heat, it has rapid superficial pulse. Common signs of thin tongue cold. If it happens by wind cold, patient's tongue is tongue with cold white. If thin tongue cold happens by wind heat, the tongue coat is yellow. External wind may potentiate or combine with external cold, heat, damp, and dryness. Internal wind may combine especially with phlegm and fire, as discussed on page 116, and internal heat in Shui may combine with external wind and manifest in red and itchy skin eruptions. Cold. Whereas wind is yang phenomenon, cold is a yin factor and tends to depress the yang of the body, specifically the yang functions of warming, moving, transforming, retaining, and protecting. Table 4.7. Signs associated with depression of the yang functions by cold. Yang functions of warming. Effect of cold is person feels cold. Yang functions of moving. Effect of cold is stagnation of movement of qi, leading to pain. Yang functions of transformation. The effect of cold is deficiency of the substance and incomplete digestion. Yang functions of retaining. If it affected by cold, it loss of fluids, for example, more copious urination or nasal secretions. Yang functions of protecting. If it affected by cold, which happens insufficient wei qi and yin qi at the body surface, with easier entry of external disease factors. Both in nature and in the body, cold slows activity and movement. In the body, it contracts the Jinruo, whether retardation, obstruction, and stagnation of the flow of qi and shui, and severe pain relieved by warmth and aggravated by cold. Cold and the diseases associated with cold are related to winter. However, just as wind may occur in any season, so the body may be invaded by external cold at any time of the year. External cold. Signs of cold may follow exposure to cold weather, especially after perspiration while wearing insufficient clothing, prolonged contact with cold wet water, standing on cold surfaces, or consumption of cold food and drink. Which part of the body is most affected by cold will partly depend on which part of the body is most exposed, and partly upon which part already has a stagnation in the flow of qi due to previous injury or predisposition. The degree to which the body is affected by cold will depend partly on the severity of the cold and partly on the degree of weakness of the body. As with external wind, the penetration of the external cold is inwards through the outer energy layer surrounding the body, through the skin, the muscle channels, and the muscles and flesh, before penetrating the main channels and the deeper tissues such as the bones and joints. The signs of external cold are: the patient feels cold, chills and mild fever, fear of cold and preference for warmth, severe pain relieved by warmth and aggravated by cold, little or no perspiration, general ache, lumbago and arthralgia, shortness of breath, copious, clear excretions and secretions, slow, light pulse, and tongue with a thin white coat. External cold tends to depress yang, and since Shen Yang is the source of all yang in the body, it tends to depress Shen Yang. This tends to affect those organ systems which are prone to deficient yang, and which therefore are reliant on Shen Yang. Reliant on Shen Yang. Deficient Shen Yang may be aggravated by exposure to cold of the body in general, or of the lumbar area in particular. It might manifest especially as copious urination. Deficient Pi Yang may be aggravated by deficient Shen Yang by exposure of the abdomen to cold, or by the consumption of cold or raw food and drink. Common signs are abdominal distension and diarrhea with undigested food in the stools. Deficient Xin Yang may be aggravated by deficient Shen Yang and by exposure of the body to cold. This may lead to stagnation of Xin Xue with pain in the heart region. Deficient Fei Yang may aggravated by deficient Shen Yang and by exposure of the lungs to the cold air. Signs include shortness of breath, coughing and asthma, as well as clear nasal discharge. Also, since the cold depresses the dispersing function of Fei, the distribution of Wei Qi and Yin Qi to the surface of the body may be impaired, contributing to the fear of cold and the coldness of the surface of the body. Table 4.8. Signs and pathology of external cold. Signs of feels cold, fears cold, seeks warmth, which pathology is reduction of yang function of warming, failure of yin qi to nourish superficial part of the body, hindrance of wei qi by pathological cold. Signs of mild fever and chills, which pathology is attempt of body to expel external cold, struggle between qi and cold, the antipathological and pathological factors. Signs of severe pain relieved by warmth and aggravated by cold, and general ache, arthralgia, and lumbago. Those pathologies is a reduction of yang function of movement, stagnation of circulation of qi and xue. Signs of little or no perspiration, which pathology is cold, contracts and obstructs the pores. Signs of headache, which pathology is retardation of qi circulation in Tai-yang channels. Signs of shortness of breath, which pathology is cold depress the dispersing and descending functions of Fei. Signs of copious clear secretion and excretions, which pathology is cold depressed yang function of retaining and reduce the proper transformation and transportation of Jingye. Signs of slow tight pulse, which pathology is cold reduces movement and contracts and tightens. Signs of tongue with thin white coat, which pathology is tongue coat is thin since the illness is recent, and white since there is absence of heat. Internal cold. External cold arises from composure of the weakened body to cold in the environment. Internal cold arises from deficient yang, specifically deficient shen yang, and the latter may enable external cold to enter the body more readily. External and internal cold may also merge together. These relationships are summarized in figure 4.1. Since the body must generally be weakened for external cold to enter in the first place, and since prolonged external cold may lead to deficient yang and hence to internal cold, the borderline between external and internal cold is rather arbitrary. However, the signs of the two patterns are differentiated in Table 4.9. Table 4.9. Comparison of signs of external cold and internal cold. Common signs of feels cold and fear of cold. If it happens by external cold, patient has chosen fever and symptoms is acute. If feels cold and fear of cold happens by internal cold, patient has no fever and symptoms is chronic. Common signs of tight pulse. If it happens by external cold, patient has superficial tight pulse. If tight pulse happens by internal cold, it is more deep tight pulse. Common signs of white tongue cold. If it happens by external cold, which is a thin white tongue cold. If white tongue cold happens by internal cold, it is thick white tongue cold. Relationship with other external factors. External cold and external wind are very closely associated. Wind tends to increase the effects of cold, both as a cooling breeze in summer or a bitching icy wind in winter. The relationship between cold and damp is discussed later in this chapter.